Comes to how easy it is for our kids to get mental health help. Today, Governor McMaster and the South Carolina Department of Health and Human Services announced the number of school-based mental health counselors has now doubled, making it easier for students to access mental health services. And News 19's Cassidy Byer has what this could mean for students.
In January of 2022, Governor McMaster directed the South Carolina Department of Health and Human Services to perform a review on what mental health services were available to students in public schools across the state of South Carolina. The department found that there were only 600 mental health counselors across the state, and that the ratio of counselors to students was one counselor to every 1,300 students. That was something Director of Strategic Services at the Department of Health and Human Services said needed to change.
The numbers had improved. We had doubled the number of mental health counselors that are available in South Carolina schools, and we had cut that ratio in half to 1 in 653.
Increasing access to services at school is something Richland School District 1 Coordinator of Social Work Services, Tony Kelly Campbell, says gives students the ability to receive help without having to leave school's campus or disrupt their classes.
If the student is having difficulty at school and it is a day that the mental health person is there, the student can get services, or the student is a phone call away. And I think it helps our parents too, because parents don't have to take a day off work to take their child to see a provider.
With the ongoing mental health crisis still occurring, according to the American Academy of Pediatrics, increasing these services to meet the needs of students is extremely important when attending to and taking care of students as a whole. That, according to Lexington School District 3 Assistant Superintendent of Personnel and Instruction, Sonia Bryant.
We have to care for the whole child. That, scores on tests, those are important, certainly. Academic achievement is important. But none of that is possible to be successful if we are not taking care of all of the needs of the child. And a huge piece of that is a mental health support.
If services continue to increase, Bryant wants to see more students receive help the way she witnessed one student do so in recent months.
The last time I was at the high school, I saw her there and she spoke to me and was upbeat, and her grades are better because of that. And she sees the mental health counselor weekly.
Although services are improving around the state, Lyritz says there's still a ways to go, even after cutting the ratio of students to counselors in half since 2022.
Our longer-term goal is to improve that further, to cut it in half again. We're going to need more people in the workforce to provide these services, more licensed counselors, mental health counselors to provide services, but we also need more community-based services.
Reporting from Columbia, Cassidy Byer, News 19 WLTX.
The Department of Health and Human Services is continuing their efforts to increase services by requesting a behavioral health budget of $16.5 million in recurring state funds to better address community-based services to get access to more counselors.